Investing in global health is investing in U.S. national security. The U.S. Army estimates that a severe infectious disease pandemic in the United States would lead to twice as many deaths as there were battlefield casualties in all U.S. wars since the American Revolution. A recent National Academies report identifies 3 primary threats to global health security. By 2030, increased urbanization could create more than 40 megacities, reducing biodiversity and increasing the threat of zoonotic diseases spilling over to humans. In the U.S., 3 million people have been infected with West Nile virus since 2009, leading to annual costs of $56 million. By 2050, antimicrobial resistance is projected to kill 10 million people and reduce global economic output by $100 trillion. AMR results in 23,000 deaths and as much as $70 billion in economic losses every year in the United States alone. A moderately severe pandemic could lead to 700,000 deaths around the globe and cost $570 billion. A pandemic in the U.S. could lead to as many as 200,000 deaths. These threats are compounded by weak public health infrastructure, medical supply chain vulnerabilities, and issues stemming from fragile states and conflict zones. And they could become even more dangerous as urbanization, resource scarcity, population growth, and the rate of environmental change continue to increase over the coming decades. The cost of inaction is high. Since 2005, the U.S. has spent more money responding to the 5 biggest disease outbreaks than on the total investment in public health and health preparedness. To learn more about how the National Academies report proposes to confront these threats to national security and continue our investments in health globally, visit nationalacademies.org/US Global Health.